Early signs of periodontal disease and what you as the assistant need to be aware of. One thing I do want to make sure that you have an understanding of is the difference between a sign and a symptom. A sign is going to be the effect of a health problem that can be observed by someone else, and that someone else is going to be you as the assistant. It could be the hygienist, it could be the dentist, and a symptom is going to be noticed and experienced by the person who's dealing with the condition. So looking for the signs for periodontal disease, we can clearly see the before and after of this patient. So one of the signs that we're going to be looking at is going to be the changes in the gingiva, the color of it, the size, the shape, the texture. We can see from the healthy tissue right here, it looks very pink. Here it looks very irritated, swollen, puffy, and red. And if you remember, the free or marginal gingiva is the first area where signs are going to indicate that something is going on. As we can clearly see here, this interdental gingiva or papilla here looks very irritated and red and swollen. So looking for that is going to be your first indication of perio disease. Next is inflammation, and inflammation, as you remember, is the body's natural defense to try to fight an infection off, and it results in swelling, redness, possibly some pain. As we can clearly see on tooth number 25 right here, there's a lot of redness, puffiness, swelling going on, so that is an indication of periodontal disease. Gingival bleeding, talked a little bit about gingival bleeding and the bleeding index, and unhealthy tissue is definitely going to bleed. As the hygienist or the dentist is going to be removing this calculus or tartar from the patient's teeth, this patient's tissue is going to bleed like crazy just because it's so irritated, red, and puffy. So there's definitely going to be a lot of bleeding, and bleeding is an indication of either gingivitis or periodontal disease, because remember, healthy tissue does not bleed when brushing and flossing. Evidence of exudate. Exudate is another word for pus. If we were to push on this inflamed area here due to the infection, pus might start to come out a little bit right there. And any development of periodontal pockets. Again, periodontal pockets is not something we can determine just by looking at the teeth. We have an idea that this patient, due to all this calculus that's on there, possibly has some bone loss. How much, we don't know until we actually go in there with our instrument and actually probe to determine what that bone level looks like. So these are all going to be signs of periodontal disease. A symptom of periodontal disease is going to be something like if a patient is experiencing a bad taste in their mouth, if a patient is maybe complaining about some sensitivity due to maybe some recession or root exposure as a result of the periodontal disease and the bone loss. So know the difference between sign and a symptom.